Hi, everybody. Thank you all for being here today. I really appreciate you showing up. So I'm Lucas. I am the presenter, or at least I hope I am. And I will be presenting today on creating a resilience-based group for gender expansive adolescents. So kind of what to expect today is just going to go over some, some like things to note, or, looking at some building like a curriculum, all that stuff. So multiple facets of group and other things. But there will be a point where, I will ask folks to unmute themselves, or if you don't feel comfortable or don't want to hear your voice, being able to chat in the box, because I'm going to ask some discussion questions. But of course, no pressure to respond, but only engage if you'd like. So, but we're going to go ahead and dive in. All right, and another thing you're going to see and notice is that quite a bunch of memes will be used today, and that is intentional. So a little about me. I know there are some folks that know me on here, some that don't. So for me, I'm a white queer trans man, so this is like part of my lived experience, as well as in working really closely with the queer and trans community. So right now, besides quarantine, right, being at home, being stuck at home, I'm the patient advocate at the UF Youth Gender Clinic here in town in Gainesville, and I've been doing that for almost 2 years. I just graduated from UF with my mental health counseling degree. Very exciting. I'm a trauma counselor. I do a lot of consulting work, and also, related to trans and gender expansive things, social justice related issues, etc. So I know most of you probably read a little bit, beforehand, but just at the conclusion, of this presentation, I'd really like us to be able to have, the language to be able to describe both, the sociopolitical impacts, on group work, with gender expansive adolescents of all kinds of experiences, being able to look and identify and apply best practices with youth. Again, we want to highlight that resilience and also the intersectional experiences that youth are going to bring to group with a decolonized feminist framework, and I'll go over what that means and looks like. Another one is to identify common narratives that perpetuate transnormativity, also something I will go further in depth to. And then also the last piece, apply and model best practices in conducting group work with youth, as well as being able to help youth advocate for themselves and you being an advocate for youth. So something I would like to encourage folks, if you do want to answer, you can. If this is just something you want to reflect on, also okay, I welcome all of it. So some things I'd kind of like you to think about before we dive in is really thinking about what words or phrases or slurs, concepts, things that have been associated with, trans and non-binary folks, gender expansive folks. And just kind of thinking about how old were you when you first heard these words, or these phrases or these concepts, and maybe not having the specific language that we do now, but something you can relate back to and be like, oh, I see how this is connected. And then, what are your reactions to these words now, and how do you think they impact, gender expansive folks, but especially adolescents? So I'll give some space if folks would like to share. I can't necessarily see the chat box because of the way that my PowerPoint is sharing. But if people have stuff that they would like to contribute, feel free to unmute yourselves.
If anybody posts in the chat box, I'll read it out.
Perfect. Thank you. Okay. So we'll go ahead. So a couple of things I'd like to highlight while we're on this topic. There's going to be quite a few things that come up. Just, some things are probably review for folks. Some things are new. I don't have any assumptions of where folks are coming from as far as knowledge and experience. I'm just grateful that y'all are here and sharing this with me today. So a couple things, in terms of looking at, sex and gender. Sex is talking about that biological, chromosomal, piece, you know, so when we look at babies that are born, we look at genitalia and you're like, oh, we're assigning them male or female or what have you. And that's that sex part. And then gender is more of the construct and the idea of like how somebody feels about themselves outside of what their genitalia, what their body looks like or has been categorized. You know, things to also think about, you know, various, you know, sexual and affectional orientations. I mean, so many different types of expressions, so many different intersectional identities. There's so much richness and difference of experience in this community, especially with youth. So just really kind of keeping that open. Transsexual is an outdated term, same with transgendered. You'll notice that in some literature that still comes up, especially maybe some older literature in the last decade or two. That's not stuff that we use now, and I can promise you that youth pick up on that stuff very quickly. And so using, you know, kind of being aware of the language that youth use, but also what's not being used is also a really great way to build rapport, not only individually, but with a group. And then just a few other things on here. And if there are questions at any point, feel free to type in the chat box. Or if it's a burning question, feel free to unmute yourself and ask me. I'll try my best to have an answer. A couple other things, just using the correct pronouns. I usually move away from the language of preferred to chosen pronouns. So I know this meme says preferred, but I like the concept of the meme, so that's why I included it. But moving from preferred to chosen pronouns to chosen name. And a big thing that I notice in working with youth, but also in my own experience as a trans person, you know, gender identity and transition is often not the main or only concern. It might be part of the picture, but that's not the only thing someone has going on. We all don't exist in a vacuum. So that's what I like to really emphasize. And when I say decolonize views of gender, it's basically looking at, you know, intersections of identity. What kind of experiences do people bring? What does gender look like for you, but also how are we socialized or taught to view gender, especially if we're looking in a European, like white lens, or we're looking at, you know, different experience, because across the world, history, culturally, views of gender are different and have changed. So it's just being mindful of the way that we're socialized and the way that we conceptualize gender and undoing some of that so we can make space for all sorts of representations of gender. And gender dysphoria looks different for everybody or isn't experienced. And that's something I'll go over in a little bit more detail as well, because it's a pretty big conversation that a lot of youth are having right now. So going to go through this pretty quickly. We all know with the DSM, the trajectory of looking at, you know, about queerness and about trans identity. There's a moth flying in front of me, excuse me. So we know that there is a lot of history there, right? So I just like to put it here visually so y'all can notice what that trajectory has looked like. And even though maybe so homosexuality, you know, or queerness is out of the DSM, it took quite some time to be completely removed. Being trans or related to gender identity or dysphoria is still present today. And so something I like to remind folks, especially when working in a group setting, is as therapists, as counselors, we all know there's already a power dynamic, right? But we have to be mindful of the power dynamic we also have with other like gender expansive folks, because they could be also coming to you for a letter, for surgery, for hormones, etc., or to change their gender marker. But something to keep in mind is that for hormones or transition related things, you know, even just changing the gender on, you know, documentation, there's still a gender dysphoria diagnosis that's required in order to get these needs met. So just kind of something to keep in mind. I don't want to spend too much time here. So culturally, we kind of know or have a little bit of an idea, I'm sure, you know, in the media, there's been a lot more conversations about trans folks and gender identity and you know, and sexuality, things like that. But, you know, something that, you know, I've noticed, and I'm sure a lot of other folks have noticed, you know, it's very much centering like lots of white trans people, you know, in these conversations, or like Caitlyn Jenner was a very big personality, let's say, that was represented. Oh, I see the chat's going off. Okay, cool. But it's important to note too that, you know, in looking at, like, culturally looking at the different experiences, looking at the different folks and expressions and the different bills, right? In Florida, we just had that bill that, you know, was trying to criminalize giving trans youth like transition related care. I was there in the Capitol, actually. It was pretty horrible, but at the same time, it was so amazing to me how many folks showed up, you know, against the bill, and it was thrown away. So, you know, something specific to the state of Florida, since we're in Florida, you know, 33% of trans people who saw a healthcare provider in the last year have reported at least one negative experience. And I know, I mean, myself, I had plenty of horror stories, but also at the same time, plenty of really good stories too. Just a few statistics, something to think about too is with Trans Day of Remembrance. That's usually in November, that, you know, there'll be a once a year kind of vigil remembering the folks who have been murdered for being a gender expansive or trans or non-binary person across the world. The US and Brazil seem to have the most deaths yearly, so that's something to kind of keep an eye on. But 331 from 2018 to 2019 were murdered. But something that I really want to focus and highlight, and that's that, you know, being intersectional, right, in our practice, is that the vast majority of these folks were Black and brown, like trans women. So that you're going to notice as far as access, but also as far as distrust, there's going to be a lot more, especially with youth, that comes up that we need to be intentional and aware of. So some mental health considerations, again, trying to keep this a little bit briefer. There's a lot we can cover here and sit with, right? But just a few things, you know, to highlight, and I'd be curious to see what other folks maybe have noticed. That social support piece, you know, getting youth involved in the community, you know, with other youth, with adults, like having mentors, groups, parental resources, those things really change the trajectory of how families and youth cope, and also how, you know, how supported they are and how much they also are, like, you know, not othered or isolated even further. You know, there's a higher likelihood of trauma history, substance use, you know, mental health history. It's mindful that, you know, a lot of folks have different mental health histories, trauma experiences, right? Just like any other client. Everyone has a different coping skill, you know, tolerance versus acceptance, being affirmed or not affirmed in school, like even what we were talking about earlier, you know, using like government name, like it's an unfortunate reality that we are in right now. But, you know, noticing even with a lot of my teens now, a lot of them with the pandemic and needing to be home and using the computer, you know, are seeing their government names every day. And so those are also considerations that will come up both in an individual and a group setting. Other things, you know, of course, psychiatric medications, you know, if there's hormones that's desired, you know, what that looks like, but also if there's anxiety and further dysphoria I've experienced related to that. There's also, I can't remember when the name of this study, but it showed that at least 16% of trans college students were at an elevated risk for eating disorders. So this population as a whole, whether it's restricting, binging, purging, is also much more at risk for different eating disorders. And with any kind of, because I get this question quite a bit, with any kind of, in looking at hormones and looking at any kind of transition related care that would be medical, making sure that youth have all the information needed to make an informed decision. Because ultimately with that, it's giving them the power of choice, knowing what they're agreeing to, the good, the bad, the ugly, the neutral, but also like that empowerment piece, providing that affirmative therapy, but also providing choice is so important with youth in general, especially with gender expansive youth.
Lucas, can I ask, someone had messaged in the chat box, and I don't know if you'll get to this at some point. They asked, would you be able to give a breakdown on the right way to speak using the correct pronouns?
Yes. Yes, I'll definitely go in more depth, but if there's more questions about that, I'm absolutely happy to answer. So something I'd like y'all to do, and this is something, well, great question, and we'll talk more about that. I'd really like folks, for whether it's in the chat, whether you want to unmute yourself. Again, I can't really see the chat, so if you'd like to speak on microphone, that'd be great too, if you can. Talking, whether it's messaging someone you don't know over chat, whether it's just talking on here, just thinking about the narratives about your own gender that you've received, and then the narratives that you've heard about trans people, both as as counselors, but also just in your personal life, in the media, things like that. And I'll give y'all maybe a minute. Okay. So, see you in the chat. Let's see, can I pull it up?
Can you see it or no?
Oh, look at that. Great. Can you explain the photo on the last slide? Right, exactly. So with girls, nice, have to do it all, be polite. Exactly. Exactly. Mm-hmm. Absolutely. Exactly. The smile, be polite. Are you having kids? Right. Absolutely. So from a young age, we all receive, and even as we're older, right, we receive so many different types of messages about, not only what our gender and our gender roles are supposed to be, but, what we're supposed to look like and sound like and act like and be like. And it's pretty exhausting when you sit and you break it down. You're like, is this me or is society telling me to do this? It's a lot, right? So it's just that being mindful of your own experience and your own socialization of gender, and also your own biases that you bring into working with this population. So a big one that folks have probably seen a lot of is the born in the wrong body, mainstream narrative, right? I know I've seen it. A lot of folks have probably seen it as well. Something to keep in mind with that, and I'll kind of unpack some of that more later, but with the born in the wrong body narrative, while it applies to maybe some folks, I can actually say the vast majority of folks that I work with, my own experience, most people at the gender clinic, there's very few folks that identify with that narrative. So it could be a helpful gateway for some folks, but making sure we don't apply that to everybody's situation or everybody's experience, because maybe for a small percentage that works, but for most, no. Same with the haven't always known. I have maybe met, out of the hundreds and hundreds of families and youth I've worked with, I've probably only met like 15 kiddos like under the age of 8 that are like, I'm a boy or I'm a girl or I'm this, and just know. The vast majority of folks, it's more as time goes on, we get the language that we need, but also it doesn't have to be this big thing too. It's like, oh, I just don't identify with this, but this is me. Okay. Whatever that looks like for folks, just keeping that experience open. Let me see on the chat here. Yes, absolutely. Yeah, loving this discussion. Thank you all. So just keeping that in mind when working with folks. Another big piece, and this is where that, both decolonizing gender, but also being aware of intersectionality, a lot of the mainstream media and narratives, centers whiteness and white folks. I mean, I'm a white trans guy giving a presentation. So these are things to just be mindful about and be like, okay, how do we better center, gender expansive folks of color, youth, etc. So just things to be very mindful about. There's no right way to transition. Everyone transitions very differently. Transition is kind of like a perpetual process. You don't just stop to finish. I mean, I wish it was that easy, but just something to, again, keep in mind. A lot of what I see at the clinic, and I'm wondering how much of y'all have seen this if you've been working with trans youth or adolescents, it's the too young, or it's just a phase, or how do they know? There's a lot of really interesting research out there about youth having some idea about their gender, whether they're gender expansive or not, having some idea about their gender by the age of 3. Just knowing whether it's different, being very aware of how they do identify. So those are things to kind of keep in mind as well. Not all gender expansive folks medically transition. Maybe some people will get top surgery, which, you know, it's removing breast tissue, or some might get a breast augmentation, but no bottom surgeries or no hormones at all and just one surgery. So again, keeping in mind that idea of not everyone transitions in the same way, and that's where that idea of transnormativity comes in, is not everyone transitions the right, you know, one single way. There is no right way, but there's many different experiences that people will come to you with, and that doesn't mean that it's right or wrong. It's just, you know, each person is different. So same with, you know, making sure we're mindful that all gender expansive and gender diverse youth, you know, even if they want medically to transition, they don't necessarily identify as a trans man or a trans woman. So just kind of keeping in mind these different, you know, themes, experiences. One really big one that well, two really big ones. The first one, that current discussion surrounding gender dysphoria in youth. When I started transitioning maybe about 7 years ago, a lot of the conversation was focused on, oh, you're not man enough, you're not woman enough, you have to look like this to pass. And passing is being like, oh, like I look male in public, I look female in public. That's the notion behind passing. There's a lot to unpack there, of course, but that's kind of what that means. It's like passing as cis or cisgender, which means you identify with the sex you were assigned at birth with. So now a lot of youth, what I'm noticing, and especially with my teens, the conversation has turned into, you know, well, you, in order to be trans in any capacity or non-binary in any capacity, you have to have gender dysphoria. Or the other piece is, well, whoever people say they are, like, you don't need gender dysphoria or not, like you just say, this is who I am and that's who you are. And so a trend that I'm noticing is that there are a lot more trans masculine folks, like, who are, you know, whether on testosterone especially, that are more in the camp of you have to have gender dysphoria and it's more of a medical condition. And I'm noticing a lot different kind of across the rest of the spectrum. So that's something that's I've noticed as a very interesting pattern. And that could be because of the ways in which we conceptualize femininity and masculinity, right? Those gender roles, those experiences. So those are just some things to keep in mind. And as far as the last piece, I've noticed a lot of therapists and counselors have both come to me, but also youth have come to me and said, well, I was told that I had to wait a year before I can write you a letter that it's okay to do hormones, or that it's okay to transition. And that's just not the case. I really highly recommend looking at WPATH, their standards of care. That's something I can send out later as well with my PowerPoint slides. So this way y'all can kind of see what the guidelines look like. But essentially, and at the gender clinic too, it's, do they have all the information needed? You know, we believe youth, we validate youth, that's best practice. And we just make sure we go over, like, this is what everything looks like. Do you have questions? This is the process. But we always believe youth, because, and something I've told a lot of parents, it's like, especially at the gender clinic, youth aren't going to go out of their way just to say it's a phase. Like, those are conversations I've had with a lot of parents. It's like, you're here at this clinic, like, you need to take your kid seriously. But that's another conversation, of course. So best practice is within the first or second session that you see each other, being able to write that letter, giving them that that ability to medically transition, because that also decolonizes the way in which we do therapy and counseling, which is, instead of that power dynamic, it's like, I'm helping you get to where you need to go without trying to gatekeep you. Because, I mean, my experience included, I was gatekept for months before being able to medically transition, even though I had been living as a trans man and using he, him, and the name Lucas for over 1.5 years.
Lucas, can you go backwards a little bit? Someone had asked in the chat a bit ago about those narratives that you talked about, being born in the wrong body, and
Okay.
And many people have always known, and asked about some ways to challenge that narrative.
Like if, for example, if like families or people bring that up, like in that kind of context?
The way they asked was, could you share some other experiences that counter that narrative? Oh, so I guess examples of like what individuals are experiencing that is not that narrative.
Absolutely. With a lot of my youth, especially, I'll get a lot of folks that say like, "Oh, I saw the word and I was like, oh, that's me. Oh, I had no idea, but there's a word for it." That was my experience too. It's like, oh, that's a thing I could do. Great. So that's one. Another is just being like, even if there isn't necessarily a certain label or identity, just being like, oh, I'm gender nonconforming, or like, I don't feel like I'm this or that. People have just been like, this is me, period. That's been another way or example. Another piece is just being able to talk to other youth. They're like, oh, like my experience looks totally different, but I had that same moment of, oh, I feel really uncomfortable in my skin. I just thought maybe something was wrong with me. Or a lot of in looking back at gender roles and the way that we're socialized, in our gender, there's a lot of pressure, for example, for women identified folks to, look a certain way, act a certain way, right? Like we've talked about. There's a lot of that body hatred. So, I mean, in my own experience, for example, I was just like, well, I mean, every woman just hates her body, right? Like that's how it goes. Like that was my experience, and not knowing, I'm trying to justify it. So even people have had that experience. It was only later for me where I was like, oh, this is not exactly that. This is a little bit more nuanced and complicated. Does that kind of answer that question? But also just giving space for youth to tell you what their narrative is. Did that help?
She said yes, thank you.
Cool. Any other questions before I move on?
I don't see any.
Cool. So other common themes that I've noticed, especially with youth, come up, and this will come up a lot in group. The bullying was really bad in school. So the bullying gets so bad I had to switch to Florida virtual school. Avoiding using the bathroom at school, or being told that they're not allowed to use a bathroom. So a lot of them will just hold it all day. Or I have a few folks who have gotten either written referrals or being suspended for using the bathroom that matches up with their identity best. A lot of it too is also like there's not one bathroom that matches my identity best, so it's kind of like a 50-50, where do I go? One parent is supportive, one isn't, or both parents, or if there's a single parent, whatever kind of configuration of family that looks like, it's either one that supports, one that doesn't. They are disowned from their families, or they had cut their families off, they're living with a legal guardian. So lots of different ways in which that shows up. A lot of what my kids have asked me in the past is like, what's good about being trans? And that was kind of one of the big reasons why I decided to start this kind of group, because all I was seeing was all this, again, we're talking about murder and suicide and feeling isolated and lonely, and you see all those things so much, and you don't see, it's like, okay, but where's like the gender euphoria? Where is the really cool experiences about being a trans person, or about being gender expansive and not being bound by certain social expectations, right? So that was a big reason why I even kind of started this work in particular, because I mean, it broke my heart, but also I was like, yeah, I have to show what's good about it, because there's a lot of really good things. There's a lot of maybe not so good things, but there's pretty cool things too. So the next one that I see a lot of is, my parents don't let me start hormones until I'm 18 because they don't want to be responsible for that decision if I decide it was a mistake. That's a big one I hear a lot at the clinic, but also I've heard, in the groups that I've done with families, they don't want to be responsible for, allowing their child to medically transition. And then the child is like, oh, it's your fault. I personally have never seen that happen. And a lot of the research shows there's very low regret, even if somebody does detransition. We've had a few folks at the gender clinic recently detransition, and they were like, I have a very extensive trauma history, and I was trying to like understand it, like, was this it? Was it this? And they were like, I was so grateful to be able to listen to what I needed at that time. And even though medically I'm not doing this anymore, I have no regrets, and I was listened to, I was validated. And so I feel very good about the decisions and the journey I was on. So that's something to keep in mind too, when parents or when people bring up that I don't want to be responsible for them regretting it. It is very, very unlikely that they would, even if they were to even detransition in any way. A lot of folks, Discord, I'm sure a lot of you working with youth, see Discord chats, and that's how a lot of folks are connected, especially in Florida, because, a lot of pockets in Florida are very rural, and so there's a lot of isolation and loneliness. And then again, coming back to that phase, everyone thinks it's a phase, but I know who I am. And again, that big piece that I know I talked about earlier is that it's not just about gender. It's a small component, but a lot of it's just showing it's like, okay, I understand this big piece of your identity. Now we can also work on the other things too. Something I tell my youth often too is, okay, you want to medically transition hormones. They don't quote fix, the anxiety or depression or this or that, but it moves stuff out of the way so you can deal with what's going on underneath as well. So that's something I'd really like you all to kind of just consider and hold on to. And that last piece, with social justice, intersectionality, feminism, like, listen, youth are on it. they've had Tumblr growing up, but they've had so much exposure and visibility, and access, that youth don't really tolerate a lot of intolerance. And that's something I'll talk more about later. It's knowing that language, or even being open to being like, hey, like I saw I was doing this research and this term didn't make sense. Can you talk to me about it? That you're actively engaging in research and showing like, hey, this didn't make a lot of sense. So youth know, and they don't really tolerate a lot of like discrimination or racism or sexism, things like that. And so being aware of also how those what experiences you're bringing into group, but also how language and how experiences can also impact the rapport you build with group.
Lucas, there's a couple questions. Someone asked if you could explain what NB means.
Oh, yeah, sure. Just means non-binary, so not necessarily identifying as, a trans man, trans woman, not necessarily in the binary of male, female, man, woman, but somewhere maybe in between. So that could be like a genderqueer person, non-binary person. There's folks that are agender that identify outside of it completely. Could be a combination of, man and woman like identities. Everyone's experience is so different, but just basically meaning that it's not necessarily man or
woman. Thank you. And the other question is, are there any studies showing a correlation between adverse childhood experiences and gender expansion?
Yes and no. That stuff I can send more out later. Yes, in the sense of with any kind of vulnerable populations, especially populations that aren't often very much listened to or believed, there is a higher incidence of trauma, but they're not trans or gender expansive because of trauma. That's something I want to make very, very clear. A lot of questions that I'll get from parents especially, they're like, okay, was my child molested and that's why they're trans? Like, no, that's not it at all. They just happen to be trans and also have this trauma experience or this trauma history. But a lot of them do overlap, but one doesn't mean the other. I hope that answers that question. So talking about that, speaking the language of youth, memes. Memes are the best way to talk to youth, to really understand what they're going through. I had an activity where I had my kids draw, if they were to be a meme, what would they draw? And it definitely spoke a lot to their personalities, but also how they were feeling that day. Lots of trans and gender dysphoria related memes are a lot of fun. Youth really love that. And it's a great way, it's an easy way to ease into that conversation of talking about discomfort and gender expression, etc. So definitely kind of be up on your cultural references as much as you can. Speak the language of youth, continuously educate yourself, and assisting, the education of parents, because like you shouldn't necessarily be the teacher, but it's definitely not the kid's responsibility. So it's like we need to step in as advocates and being able to be like, hey, this is what this actually means, or hey, here's literature that I can provide you. And something to keep in mind, I have a resource list that I've created for a lot of the families that I work with. So I'll make sure I get that sent out to you with my PowerPoint slides, and it has a bunch of different articles, different like, you know, Trans 101, et cetera. So, you know, there'll be a lot of information on there to share as well. And the big things in doing, you know, strengths-based and resilience focused, you know, it's like asking youth what they really need, but also really making sure we're centering our youth of color, because there's still a lot of spaces. And this is something that, you know, I was working with too, is, you know, a lot of my group members were white. And so that's like, okay, how do we as providers do better in creating room for intersectional identities and making sure we're reaching all, you know, gender expansive youth versus a select few. So that's something to be really mindful about. Yeah.
Lucas, are there any specific resources for younger siblings?
Yes, I have it on my resource list, and I'll make sure I send that out. Great questions. So I'm gonna move through these kind of quickly because I want to make sure we get to more of the bulk of the creating the group and being able to ask questions, and also maybe doing some discussion. But, you know, some of the pretty straightforward barriers, right? The lack of parental support, lack of trust in providers, especially at different intersections. So like, you know, Indigenous trans women or, you know, queer trans men, you know, there's going to be a lot more distrust in the system in many ways because either they've been erased or their experiences have been so crappy, you know, that they're like, maybe I'll just put this off. So the lack of culturally competent providers, I've had a lot of people reach out to me across the state of Florida, but also even just in Gainesville. I mean, I'm the only trans provider that I know about, right? I can't assume I'm the only one. And the community here is pretty small, but, you know, so it's also another layer of being someone who's queer, being someone who's trans, and also providing services in that community. It's definitely, you know, a process in figuring out what those appropriate boundaries look like. Then the lack of intersectionality. So somebody, you know, I was talking with someone about this the other day. You could be a queer person, but if you're a white queer person, you might not know about, you know, talking about racial issues or racial justice, anti-racism. Or you might be a person of color, but, you know, also with disabilities, maybe you don't know as much about that. So that intersectionality and making room for all these experiences, it's really important as providers that we do the best that we can to educate ourselves and stay kind of, you know, immersed in literature and immersed, you know, in culture. Then those bills, private therapy often doesn't take insurance. And then in the US, you know, we're 4 times more likely to live in poverty just as trans folks, gender expansive folks, and then up to 6 times if they're trans folks of color. And so that advocacy piece, making sure we model for parents, families, for other staff members, you know, if we're working in a group practice or a clinic or a hospital, modeling correct pronouns, correcting people as needed, you know, providing resources, which that's what I'll do for y'all so you have those resources, getting involved as much as you can. I mean, right, we all only have so much time in a day and we're already kind of stretched thin as counselors, right? But doing our best to even, you know, make an appearance at certain events, places in the community, just so you're a face that's associated with being trustworthy, being somebody who cares. And then just creating open and affirming office spaces with flyers and stickers, you know, all gender bathrooms, you know, some cultural competency training, stuff like that. And just remember that people don't owe you their stories, but if it is helpful for them to share that story with you or to be like, this is what my experience looks like, you know, providing that openness and that space for folks to share, especially in a group setting. Good. So something I would just, you know, in looking at resilience and strengths-based, I'm curious of what resilience looks like or means to folks here. And feel free to put in the chat, unmute yourself.
Asking for help when you need it.
Definitely.
Continuing on despite barriers. Human capability to deal with adversity.
Right. Exactly. So our ability to maybe to persevere or to, find strength even when maybe everything kind of seems like it's all against us. The ability to come back to your true self. I like that. So in, thinking about resilience and strength and being able to bounce back, right? Kind of like what folks hinted at, in gender expansive adolescents, that things to kind of look at as far as resilience or protective factors, supportive family shows that increases a child's resilience and reduces rates of suicide just even by using the correct name. So supportive family, supportive community, building those external resilience, so being involved in community setting, reducing isolation, building that internal resilience, having hope, making the world a better place for the next generation. I've had some kids, say that to me, like, that's why I do what I do, because I want to make the world a better place because the people before me made it better for me. Something I love about, trans youth and gender expansive youth, being able to assert who they are and advocate for their identities and make people sit in their discomfort instead of, internalizing shame or taking that and being like, oh, I need to make you feel comfortable. Sometimes it's painful to watch because you're like, oh no, but it's really cool to be able to watch youth just own who they are and also being given that permission to do so too. And that other piece is being able to utilize good self-care, feeling dysphoric if gender dysphoria is something that's experienced. And this meme talks about watching that experience happen. It's uncomfortable, but it's also pretty funny. In looking further at resilience, being able to, with any kind of resilience with freedom, right? Freedom is a big part of also that resilience, is being able to define one's own gender and rejecting binaries. That goes also back to that question earlier, is like, how do we disrupt that mainstream narrative? By just specifically being able to self-define, by rejecting that a binary of man, woman exists. And also being able to live authentically, right? That's resilience embodied. Challenging the status quo, again, that, dress codes, bathrooms. I had a kid who got in trouble the other day, actually. Well, not the other day, was in trouble and told me about it the other day because the principal wore the same pants, but then the day later she wore the same pants and was, out of dress code because she's a trans woman, and they were continuing to misgender her as male. And so she said something pretty sassy and said that she looked better in the pants and got suspended. But, so you're going to notice those things kind of come up too. Same with baby showers, the way they conceptualize relationships, both platonic, romantic, whether it's monogamy, non-monogamy, relationship anarchy, there's so many different configurations. So watching youth really just kind of, in a way, decolonize the ways in which we have gender show up, how we have, how we show up in a Western society, watching them really just take up space, but also giving themselves and each other the permission to do that. Being able to connect online and in person to other gender expansive individuals. And the thing I notice with youth, they are constantly navigating being misgendered and constant invalidation, familial relationships, and then they're still here showing up. So on one hand, there's a lot of resilience there and being able to reframe negative events, or being like, you know what, I don't want this to happen to other people. I'm going to go and do some activism work, or I'm going to get involved in this so that this doesn't happen for other people. Like that resilience, that empowering piece is really cool to watch. But then on the other side to look out for too is like, if someone is internalizing all that shame, or is feeling really alone, or is feeling really suicidal. So you're going to kind of see across the spectrum of experiences. So kind of getting to the development of group. So everybody has a different theoretical orientation and approach and experiences. So of course that, is something to consider. So there's not one right theory or one right way to have a group, right? But something that I would personally recommend is if you are a cisgender counselor and you're trying to run a trans group or a gender expansive group, really finding a way to include gender expansive folks in the community, in the planning and the advertising and implementation of group, whether that's like financial compensation. Again, I know we're not rolling in money here, right? So there's other ways too, like such as being able to say, okay, you can put this on your resume, or there's some kind of deal, but I, in order to not only build good relationships with the community and being able to give kids to other members of the community, it's also modeling like, hey, I'm putting my money where my mouth is, or I'm modeling what, that respect and responsibility looks like. You're modeling it for youth as well, and for other counselors. Or collaborate with an experienced clinician who is experienced in working with gender expansive youth especially, but youth and adults. Doing outreach to community groups. So for me, I advertised on Facebook groups. I advertised, with different providers. I told people in the community just to go around and talk to people, let them know, here's my email, because I had a professional email that through the gender clinic I use, and so a lot of folks have. But kind of getting creative when it comes to advertising these types of groups, because just typical advertising in a building or a clinic isn't going to cut it, because a lot of folks aren't going to see that. Or if they do, they're not going to in person go and either take, a flyer, or they're going to take a picture of that. A lot of times it's going to be more under wraps. But some things to really think about that are really important to include in this kind of group is, looking at intersectionality, intersectional feminism, and queer theory, because it gives youth, but it also gives you the language to unpack experiences and have conversations in the youth's language that are going to happen. But it also shows that you are someone who is willing to learn, and someone who is in tune with the conversations and the reality of trans youth. So as far as that resilience piece goes, obviously building resilience, having it be strengths-based, because youth see a lot of just like really not so great messages on the daily about being, a trans teen, or about being a gender expansive youth in Florida or across the country, or suicide rates. So it's like, we want to also counter some of these messages, while on one hand we embrace the reality of like, yes, these are things that are occurring. We're also inserting healthy and positive realities of like, but that doesn't, being a gender expansive person isn't a death sentence, because I've had youth ask me that too. And a big thing that folks will forget, just making sure that your restrooms at your practice or wherever you are, that they're gender neutral and accessible. And the minimum 8 sessions here that I put, like, this isn't a must have, but I personally, what I had noticed a few times in running this group, that 8 sessions seemed to be the sweet spot as far as, in building group comfortability and dynamics. Because a lot of what I have also noticed is there's a lot of social anxiety that overlaps with gender expansive youth, because, for so many reasons, right? In looking at, am I going to be misgendered? Do they actually see me as who I say I am, et cetera, et cetera. So when I say curriculum, there isn't, again, one necessary curriculum, but I provided an example here of something that I've done, and you can feel free to use as well. It'll help kind of in creating and developing a group that is not only relevant for trans youth, but also gives them some power too. So curriculum is a very loose term. So the biggest thing that I have personally noticed in working with a lot of gender expansive youth, having good coping strategies and not internalizing everything, but being able to be like, okay, how do I ask for support from my friends? Who are the people that I trust? What is mine and what's everybody else's? I've noticed with a lot of youth and a lot of adults as well, like a lot of gender expansive folks are very disembodied and don't want to be in their bodies for a lot of reasons, right? Especially if there is an increased overlap of trauma and a trauma history. So I personally, for me, I like to do a lot of embodiment and mindfulness work, but that's not necessarily a must-have, but just, again, bringing presence and attention to the body in a healthy, helpful way, but also giving folks the option to not tune in at all, because we don't want to force and then trigger something either. So the next part, building that resilience. So the internal, external, positive identity development and affirming practice. So affirming youth's genders, but also getting them to affirm each other and themselves. So another part is understanding the needs of your youth. Like, don't assume that I always ask, so before every group, even individually, I'll ask people, it's like, what are things that you wish other therapists would know? What are things that would be helpful for this? And they'll tell you, you just got to give them the space. And that's with youth in general. I think culturally, we don't really give youth a lot of credit or a lot of space to give us the wisdom that they do have, because there's a lot of wisdom in being a youth and being an adolescent in rebellion, right? That's how we grow. That's how we change. So I also, I encourage the rebellion with my youth, which maybe the parents don't like so much, but that's all right. So what are your youth, what have they identified as issues they want to talk about that are gender related and not? So again, that, it's not all about gender. That's what I've had so many different youth tell me, make sure therapists know that. And so that's a direct way of asking that. Or after every group I would do, I would have a form or a way of submitting anonymously, like, hey, can we talk about this subject next week? We got a few folks who would give the feedback, but a lot of times they were like, oh, I want to talk more about Shrek because Shrek is a meme thing that's in now. So I made a PowerPoint presentation on Shrek about being able to talk about, okay, onions have layers. What are your layers? And I use that to build rapport, but also be like, okay, we're going to be funny. I'll be funny too. And they respond well to that. So don't be afraid to be a little sassy. So also a big thing is that introduction of having trans folks or gender expansive folks thriving, especially at different intersections, like celebrities, positive stories, experiences, being able to collaborate with the community, even doing some kind of mentorship type program. That's something that was like a dream of mine to be able to have. But being able to do some collaborative work, especially with folks in the community, especially maybe trans elders, that's something I'd really recommend. Reflect on your own biases, your own gender, your own experiences like we did before. Disrupting our internalized transphobia and that idea of transnormativity. So being trans doesn't look one way, being, gender expansive doesn't look one way, it looks so many different ways. And just because someone shows up and it looks one way, it doesn't mean that's the only way. Build a fun, safe, inclusive group. If you're just serious all the time, they're going to tune out, as you all know, right? Like folks from here maybe have kids, work with teens, etc., right? They will tune out. So also you want to make it fun, because it doesn't have to be this heavy, serious thing. A lot of their lives are already heavy enough. And the biggest thing I've noticed with my youth is building in that space for self-expression and creativity. A lot of my youth have been amazing drawers and painters, and they're all like, oh, my work sucks. And I'm like, this is like the Mona Lisa, but okay. So just giving folks that room to express themselves, because in that group setting, you might be the only space in which they're able to actually express themselves in all capacities. So some things to kind of think about. What are some things that have worked for you in groups? What hasn't? And then how do you incorporate that into this population? Feel free to put in the chat, unmute, if anything. Thank you. The Shrek one was fun. Yes. Yes, creativity and flexibility are key, definitely. There are a lot of folks that do compete for space, because again, a lot of them don't have a lot of space really anywhere else. And I'll go into this further. Great question. I always set group rules in the beginning and ground rules, and kind of remind each group, like, these are the agreements that we've come to, and like some different ways I've used it is like, okay, one diva, one mic, or if somebody's talking a lot or tends to talk a lot, switch it up. Someone who doesn't tend to talk a lot, speak up, and of course, whatever as far as accessibility to, like, if people are able to, but making sure from the get-go we have those group agreements and ground rules so that we can also model that for our youth. Does that answer that question? Cool. Awesome. Exactly. Because youth know, and they're used to everyone else telling them that they don't know or that they're too young. So giving them that space and listening to them, absolutely. Loving all the feedback and commentary on here. Thank you all. So in looking kind of at that screening process, what I personally did is I, again, made sure the room was very affirming, made sure that, parents and youth had an idea of what to expect ahead of time, modeling the right use of name and pronouns with youth, even if the parents mess it up, you continuing to use that. Build that rapport with parents and youth. I mean, as y'all know, a lot of you here are probably working with families and youth, and a lot of the work with youth is working with their families. And so if the families don't like you, it's a little bit hard to navigate. So finding that sweet spot, right, between building the rapport with families, but also strategizing with youth and being like, what do you need and what's actually going on? Because a lot of families will say, this is what's happening, but the youth is like, okay, that's not really true at all. This is what's happening. And then sometimes there's something in the middle, but making sure you give that space for youth one-on-one. I know conversations I've had with a few of my youth is being like, okay, how do we strategize and get you to be 18 and be okay? Sometimes that's all we can do too, but at least having that frank conversation with especially gender expansive youth, I mean, then they'll know it's like, okay, wow, they really get my experience. Set the attendance expectations. So I tell folks like, I expect you to be there. And if you're not, either there's, you're sick or there's something wrong, but just check in, let me know that you're okay. But really setting that expectation of like, I expect you to attend groups. And a lot of it now has been virtual, but folks have still been showing up. So making sure that we are expecting them and like to have that commitment and to show up. And giving them that responsibility and trusting that with that responsibility also encourages youth to continue to show up. And so then it's that connection, right, of providing youth and parents with local community groups, resources. I know in Gainesville and a few other places in Florida, there's, a trans group, but then there's also a parent group. So, the parents can all meet and be like, all right, is this what's happening with you? Because something I tell a lot of parents is I noticed that a lot of parents will initially grieve, like when a child is like, hey, I'm trans, hey, I'm this, but that's not something you discuss with the child. That's something you discuss with a therapist or another parent or another adult, but that's not the youth to discuss with you. What's up?
So someone asked, how do you balance when to correct misgendering or pronouns from family or others, or just modeling the proper usage?
Honestly, great question. I wish there was one, but it really just varies every time. A lot of it, reading the room like we all do, right? But for me, I very intentionally always use correct name and pronouns, even if the parent isn't. And then sometimes if I notice that this is happening a lot, I'll be like, hey, I really would like to encourage you to use this name and this pronoun. Or something that I've done is if I, notice this disconnect happening with family and with youth, I'll be like, okay, we have the family part and now I'm kicking out family and now I'll talk to the youth. I've had youth be like, just don't correct them, let them say whatever name they have. I just need to get here. That's all I had to do. And so you can strategize even then and be like, okay, I will continue to use the correct name, but I won't correct them. Or if the youth is like, no, please correct them, then you'll correct them and then also use the right name. But that's personally how I balance that. And then, so it's that, again, what are youth looking for in this group, but also what do they need from you to make sure that they're feeling safe? So looking at the implementation. So that group agreements, kind of like I was talking about earlier, really making sure from the get-go, I look at a lot of like social justice related like group work or, restorative justice practices and being like, okay, what are some, guidelines or frameworks that have been used that I've really liked. I've done a lot of facilitation of groups and social justice work. So I've also taken a lot from there and implemented that into the ways that I do group. But I like the idea of coming up with group agreements and communal goals because it also, you're not only involving you, but you're showing the youth that they're a really important member of the group and that what they say matters. So for me, what I usually do is, making sure everyone respects name and pronouns and identity. Same with if the conversation about gender dysphoria or not comes up, being able to have a civil conversation about that. Really incorporating, that building communal support, something that I've done. I think my last group, I had one of my youth build a little Discord server and add all of them to the Discord server so that they can talk in between group and either practice skills or that they just have each other, because so many of them are so isolated. So it can even be something like that, or connecting them with another family, or things of that nature. Being transparent, yes, I did that on purpose, but also being transparent and authentic, because youth kind of know when you're full of it, right? Incorporating positive pro-social experiences. In a lot of ways, group is the way to have a healthy, positive social experience. Youth just knowing that they're seen for who they are and all their experiences, that in itself is so healing. And I've noticed just how healing that is, let alone if we're incorporating coping strategies or having conversations, etc. A big thing that I'm trying to do with my youth, and this has kind of been a work in progress. It's like empowering that youth leadership. It's like the buy-in from youth. So getting youth to trust that what they say matters and what their experiences are, like they, deserve to be shared, but also being like, okay, you have say in how this group goes. Because a lot of youth, especially the ones that I've worked with, have come from very either chaotic households where there's no stability, or there is no, like, what they say doesn't matter, or they don't have a space that they could ever, verbalize, hey, I want to do this thing, and it be followed. So a lot of it too is building that trust and rapport, and the more group sessions you can have, the better, to build that rapport, so then there is more buy-in from youth. Something I've done before, or I've mentioned to youth, or I've done even individually with youth, when we're feeling especially powerless. So when that bill about, criminalizing transition-related treatment was up in Florida, or, when the Trump administration is trying to redefine what sex and gender looks like, it's like, okay, I feel powerless in a lot of these other situations, or my family doesn't accept me, but at least I can do some advocacy in this way. So like writing letters to politicians, even like pen pals. I've had people connect with other people across the globe. Again, Discord is a great way of doing that, but encouraging as much communal engagement and like advocacy work as possible, because that also brings that empowerment piece and builds in that resilience. Making sure we leave space for processing and questions, because things come up, especially the more comfortable they'll get with you, the more some really wild stuff comes up, but it will come up. Like the Shrek PowerPoint brought up a lot. I was very surprised. So some tools and things that I've used the self-care plan for gender dysphoria. So, it's incorporating what are some resilience-based skills I can use, but also what are ways that, and coping strategies that I can specifically use to take care of myself, or what are things I'm picking up on in my body and my brain that shows like, hey, I'm having a really bad, maybe gender day. Doing some structured processing, leaning in for a few minutes, lean out, and go to a different activity, things like that. Keeping the space affirming and open, encouraging that self-expression, but also encouraging your own self-expression, because they're not going to participate with you if you're a robot and you're not yourself either. Because youth, as all of us who work with youth pretty regularly, youth know when you're not being your real self. So you got to bring you into the room too. Validate experiences, be wary of those power dynamics. Again, that's always going to come into play. And something that I've done before is we incorporated that creativity piece of drawing, but also coming up with like a mantra. So one of my first group that I did, they came up with the mantra, bones are cool, you have bones, therefore you are cool. And they drew this group quest that I don't even know how to describe, but it was wacky, but it was great. But it really brought the group together, and it brought a lot of laughter. And then it also made people more comfortable to share their experiences, or to be like, wow, like I didn't realize I could have so much fun in a group space, because that's really cool to hear. So some other interventions or things that I've used or referenced, any kind of resilience building, being able to, build in that advocacy, that empowerment piece. There's this book that I really like by Dr. Annalise Singh. It's the Queer and Trans Resilience Workbook. Love that book. Highly recommend for families, for youth. I've had a lot of youth use that. I think that's on my resource list, but if not, I can send that out. Again, some feminist theory into evidence-based practice. So finding that way to combine different intersectional experiences and knowledge into evidence-based practice. Teaching coping strategies and skill building has been super important. I've noticed that skill building piece has been a lot more important than I realized. And then again, increasing that resilience with acceptance, increasing self-efficacy and boundary setting, reducing avoidance, because youth love avoiding, right? We love avoiding, everyone loves avoiding, so it's reducing that avoidance. Normalizing that minority stress impact and recognizing systems of power. That's where that feminist theory comes in, and being able to acknowledge the systems that, you know, oppress us, who majority, non-majority people are, things of that nature. Affirming identity and various healthy expressions of identity, and building a client's own narrative and goals. I think there was a message on the chat.
Just me saying I love Annalise Singh.
Yes. Yeah, they're the bomb. Okay. So maybe doing a little bit of practice, because again, I do like to incorporate some, you know, discussion, conversation. I know it's a different dynamic. If it was, you know, we were all in the room together, sometimes it's easier to do that versus over Zoom. So thank you all for being flexible and figuring this out with me. But just kind of wanted to see some group commitments that have been helpful for you, or what you think this population could need. So like for me, respect, I've said, you know, respecting people's identities, respecting people's experiences, being willing to have courageous conversations, one diva, one mic, things of that nature, or ouch or oops. So if someone says something that's hurtful, being able to be like, ouch or oops. And that gives people a way of being like, okay, I need to pause, and then how do we address what just happened here? But I'm curious of what other things that could be helpful, what things have been used before in groups, things of that nature. And I'll make sure I send out to some of the group rules that I've made. So this way folks can reference that too. So kind of wanted to review, and then I wanted to leave a lot of time for questions, conversations, because I know there's so many questions. I know there's so much material. I know there was a lot in here too. So really wanted to leave a lot of space for conversation. But some final thoughts, you know, the importance of creating caring communities, you know, building that empathy and building like that communal resilience, the spaces for courageous conversations and brave spaces, really loving that language that's been emerging with brave spaces or healing-centered engagement, because being healing-centered is trauma-informed, and having fun, because you can have all the right tools or you can do all the right things, but if it's heavy and serious, like they're gonna tune out. I'd tune out, right? So making sure that we make it accessible for all sorts of folks, and trying to be as transparent and authentic as a facilitator as well. So I love Laverne Cox, and I always love this quote by her, it is revolutionary for any trans person to choose to be seen and visible in a world that tells us we should not exist. I always love that quote. It's always stuck with me, and I always tell my kids that. And so that's also that piece of showing, you know, different books, different celebrities, different pieces of literature out there that youth can see and relate to, or even to model, or just be like, okay, I'm not alone in this. Because sometimes, especially in our really rural areas, they're like, I know I'm most often the first trans person anybody meets when they walk through the doors at the youth gender clinic. And I get a lot of the like, oh, I would have had no idea you were trans. Don't say that, because no one ever knows. That's kind of the whole point. So I have some references. And this is also my email as well. And so I'll leave this up, and then we can have a bunch of questions, things, and conversations. But I'll leave this up so y'all can write down my email. And then again, I know when I send out the presentation and you know, some resources, that'll be there as well. But just want to open the floor up for lots of conversation, good questions. Yeah. So what do we got?
Can you see the chat box, or do you want me to read from it?
All right, now I got it.
Okay.
All right. Thoughts on how we can help individuals we may know outside. Ooh. Sorry, y'all. Technical difficulties. Okay. Really like what you said. Curious about thoughts on how we can help individuals we may know outside of our roles as therapists. Okay. Right. And, you know, you bringing that up, Christy, I mean, thank you for being those adults. You know, it says a lot about how much you're trusted too. As far as things that you can do to be helpful, I mean, continue being that space where it's like, okay, you're at least that one space, those adults that will affirm and see the youth for who they really are. And those are the youth that I have a lot of parents who will come in and be like, yeah, we're everybody's parents, you know. Continue to do that and model that for other parents, whether other parents or adults see that or pick up on that. But kids know. And if the kids know and youth know, adolescents, they see it. And they'll also tell friends, they'll tell other people like, hey, these people are safe. So same with even providers, right? I mean, I know here in Gainesville, for example, like speaking from my experience, both as a provider, but also someone seeking services of all kinds, you know, if I found out, I was like, ooh, this person, yikes, no one ever go to them. I would tell one person, or I would blast it out and be like, this person, don't go. And so word travels very quickly in the community. So, you know, people will not only share on their own, but also you modeling that is another way of like being visible. So kind of keep doing what you're doing, keep having those conversations with youth that you are doing. That's some of the best things that you can continue to do. Okay. Okay. Ooh. Okay, so trans, non-binary, gender expansive terms. No, great question. So everybody uses a different different thing, language. It's really using the language that you choose, but for me personally, I tend to use more like trans and gender expansive. Um, Gender expansive is a really inclusive way to include all identities, but I've used gender expansive, gender diverse, trans, non-binary, agender, gender expansive, but I tend to go with the most umbrella term, so either like a trans or gender expansive, gender diverse, but there isn't necessarily no right term, but trans itself is more of the umbrella, but I usually like to challenge that because a lot of non-binary people don't necessarily identify as transgender, and vice versa. And so as far as exploring with, you know, terminology, just follow the language that they're using, but also even in asking them, being like, are there any other ways that you like to describe yourself, whether it's related to gender, etc. Great questions.
Did you see the one about have you ever incorporated or used group or participant social media and or information technologies in group work?
Ooh, yes, I see it. Yes. So something I've done, like sometimes I'll do like the little like poll everywhere, or we've used like Jackbox, or we've used like if there's a meme or something that someone relates to. We've used different things. That's something I'm still exploring a little bit more of, because especially with Instagram, being able to incorporate Instagram a little bit more into groups is something I'm currently toying around with. But as far as Discord, like Discord servers that I had my youth build, I think my last group, they built their own Discord server, so it was only for them. So it was only for like the trans group that they were on there and could talk back and forth, and stay in contact, you know, even in between session, but also after group is done. So that's something that I've used as well. I've used games, I've used Jackbox, especially virtually with the pandemic right now. That seems to go really well. So it's Jackbox and Drawful too. Those are really fun. But Instagram and Discord are really big mediums that I've noticed youth really prefer, but also use quite a bit. So you can even point them in the direction of certain pages, of certain Instagrams, even and Twitter, same thing, of certain or people to follow. Like that's also something we can incorporate. Okay, so looking Natalie. Right, and that's a great question. And so that's where that piece about transnormativity comes in the sense of, even the DSM says it's like, with gender dysphoria, you have to be experiencing this, this, and the other thing, right? Or like experiencing extreme distress. A lot of the ways societally that we look at any kind of issues is really framing that in the negative or lack of or scarcity. So like we have gender dysphoria, but a lot of times we don't talk about gender euphoria. So the things that make us feel really good about our gender. So that's a lot of what I try to bring into conversation with youth too. It's like you don't just feel crappy about your gender. You also have moments where you feel really good about yourself. Like, so a specific example for that, when people still call me Lucas, I still feel almost euphoric, and it's been 7 years. So even little things like that, or when you're wearing an outfit and you're like, I feel like I look good. And I also feel like I look like how I'm presenting myself. Like those are moments that are euphoric as well. So with dysphoria, so in looking at more of those non-binary identities, agender, genderqueer identities, people who are kind of more outside of the binary of trans man and trans woman, they don't necessarily like with the binary of trans man, trans woman, there is a lot of like medicalization of, in order to have hormones, you have to be a man, or you have to be a woman, you have to be this, or you have to experience hating yourself or experience such extreme discomfort. But sometimes you're like, oh, I'm just not this. I'm not uncomfortable with this, but I would feel more comfortable if I was this. And that was a lot of even my own experiences. I felt I had some gender dysphoria, and that's also unarranged. Some people have a lot, some people have a little, some people have none. But the way with gender dysphoria and using that to provide treatment, think of it as like an access point, or you're using the system in the way it's like, okay, I have to get my needs met. So for example, like with private pay insurance, right? We will often bill something with the DSM for insurance so we can get those visits covered. It's kind of the same concept. So even if someone doesn't have dysphoria, being able to be like, okay, I'm putting dysphoria because we need to get this covered so you can get these services covered, or so this shows up on your chart. And I'll have a conversation of what dysphoria, what that looks like, and what that will look like on their record. But if someone doesn't necessarily want hormones, or doesn't want like surgeries, doesn't want to change their gender marker, which is that male or female, at least in Florida anyway, on your ID, on your birth certificate, then you don't have to put dysphoria at all. But if it is relevant to the care that they need or are seeking, then that's when you would put gender dysphoria. And then of course, if they are saying that they experience dysphoria and they relate, and that's a way that they describe their experience, then that as well. I hope that helps answer that question. Great questions, everybody.
It looks like the next one is, how do you typically manage if a client wants to explain their identity to their parents, but are worried about the reaction that they'll get based on religious beliefs or closed-mindedness?
Great questions. Yeah, this is a tough one, because that's where I always try to emphasize how important it is to strategize with youth one-on-one. So I can think of a person we had come in the gender clinic, I want to say sometime in February, before everything kind of shut down. They were very Catholic, and were very like, were misgendering their child. But a lot of it was that genuine fear of like, my child's going to go to hell if, this, and the other thing. Or being like, this was their God-given body. And I'm just using this specific example, but like, this isn't the only example that I see at all. And it's actually a lot of like religious parents that I've worked with that have come to the clinic have actually been really lovely. So, but I'm using this specific experience just because it's very salient in my mind. So they didn't want to call the child the right name, pronouns, were worried about the child going to hell. And a lot of it, again, it comes down to that, separating, having that conversation of like, so when you say these things and building that empathy, this is what your child is hearing. So for example, when I had said to the parents, it's like, I can understand your concern and your fear, and you want your child to be well and to be happy. But when you say these things, this is what your child is hearing, that they're a monster, that they're bad, that there's something wrong with them. And even framing it in that way, they're like, oh, I didn't realize that's how that was coming off. So it's that empathy building. Another part is that strategizing with kid one-on-one and being like, okay, how do we get you to survive, and how do we get you to outgrow the house? There's quite a few people I've had that conversation with. It's like, all right, where are the spaces we can at least designate for sure your safety, for sure feeling seen, and how do we navigate the chaotic spaces or the ones you're not seen in? And how do we just power through it till you're 18? So that's, that's something that we've done. Another thing I've recommended for families too is I've connected them with other families. So I've gotten permission to share, certain family members like, email or, kind of had a release form and be like, hey, can I share this with other family members? Connect them to other groups. That honestly, that building visibility and empathy has been one of the best ways that I've gotten parents and guardians to really get on board in some capacity. Another thing too is, so at the gender clinic, what I've also seen happen is there's a lot of parents who've come in, they're like, absolutely not, no way. They talk to me, they meet a trans person for the first time and they talk to the physician, and they're like, okay, I have a lot better of an understanding than I thought this was gonna be. And just giving even more of that in-depth conversation of, this is what, this looks like, here's maybe some terminology, here's some resources. And that I've seen a lot of change with some parents that way. And then sometimes it's the acceptance of, no matter what you do, there are going to be some families that will not see their child. They just will not. And so that's like, how do we get that child to be seen everywhere else? Like, for example, that one person who had posted earlier was, we're the adults that those children or those youth come to. So creating even those spaces, or that group space is the one space that, your youth feels seen and heard in multiple ways. Hope that answers that question.
Is there a resource that provides the definitions based on each pronoun that can be used within this community?
Yes, there's a few pronoun related resources that are on my resource list. But the thing to kind of keep in mind, it's like same with, experience, everybody uses different pronouns for different reasons, or might interchange them with a few types. It's just following the language of the client, but just being aware of the different types of pronouns that exist. And even if you mess up, this is another big one I like to say, even if you mess up or you don't get it right, quick correct and move on. Don't make a big deal of it, because that also shows the youth, it's like, oh, I recognize I messed up, fixed it, moving on. Because then it becomes about you rather than the youth. A great question. Let me see. Okay. Looking through all of these. Sorry, y'all.
The one comment says about, or question rather says, so all of those terms mean the same thing. And so I'm guessing that goes back to when you were talking about like gender non-binary and non-conforming and expansive and things like that.
I mean, the same thing in the sense that it's basically like everybody who's not cisgender. But so they don't necessarily mean the same thing, but they're different ways of saying like this person's not a cisgender person, which means like identifying with the sex you're assigned at birth and how you're, socialized based on that sex assigned at birth. So everything means something different, but it is related to being like, okay, but I don't identify as a cisgender person. I hope that helps.
Okay. When writing a letter for surgery, it usually asks if the client is stable, in quotes. What would be an appropriate level of stability?
Yeah, and you'll see that a lot, especially, I can also send a few templates for letters as well, and things that I've done in the past so folks can see. I mean, obviously there won't be any private information in there, but I can send those as well. But yeah, with stable, I mean, something that I've done personally, I've talked to my clients I'm pretty open and transparent with my people, whether they want to hear it or not, right? I feel like as counselors, that's kind of our job. So if there's paperwork that people have questions about, or if there, are concerns that surgeons or other physicians have, I'll be like, so what do you think they mean by this? Like, what does stable look like to you? Like, that's a conversation I've had directly with somebody. But when I guess the surgery letter is asking for stable, an appropriate letter, appropriate level of stability could be, so let's see, did not research what this would include. I mean, could be like, okay, maybe I'm working on some hygiene stuff, right? Like, especially as adolescents and youth, like that's an ongoing thing, especially if there's a lot of teens that don't like their bodies and they're trans or gender expansive and they're feeling really uncomfortable. A lot of times the self-grooming will be behind. It's just making sure that they have all the information and that they are able to make an informed decision, even if maybe some of the other stuff isn't there. So it's like, oh, I didn't clean my room today. Yeah, that's pretty appropriate. But being like, but I understand what all goes into having surgery. That would be kind of what stable means to me, is being able to make that informed decision, having all the information, and like being able to be present while making a decision. Does that help?
Just wondering your thoughts on the child who is reluctant to take part because they are embarrassed by their own poverty, language issues, or intellectual disability, and your experience with the parent who's incredibly supportive of their child's journey, but when their child is out of the room, they're terrified of their child's journey. So
Yes.
There's two different scenarios.
Yes, and those are honestly great questions, and these are things I've seen a lot. So for that first part with the reluctance, I can't think of, there's really only a few folks that I've worked with that have not been so afraid of their own, disparities in language, or, or an intellectual disability, or being afraid of looking stupid, or, insert here, right? But I think in the reluctance piece, it's just creating that safety and showing that it's okay to mess up, or that when people do mess up, or you're modeling behavior for your teen or for your adolescent, and like showing like it's okay to make mistakes and not know it all, but also show that you're not going to be isolated. But even further, making sure outside of group, like, hey, are there extra things that I can do to make you feel safe? That's something I've had direct conversations with a lot of my youth of like, I know you feel really embarrassed about, your reading comprehension, or your lack of vocabulary, but what's something that would make you feel safe or seen or heard in a group setting? And also what's a way that, we can build some of that trust with your peers. So it's just, I've directly had a lot of conversations related to that, but also just making sure the content is developmentally accessible, and, as accessible as possible. Same with like, if, so we're in person and group doing activities that if somebody, say for example, can't walk, making sure you're not forcing them to walk, or you're not necessarily isolating them, or making content, very, very understandable and easy, just so you're not assuming anything about anybody's ability status. But I've pulled kids aside before and during the screening process and being like, what are some concerns that you have? And what are ways that we can address these concerns together as a team, but also as a group? And then as far as the experience with the parent, yeah, I see this one so often. And how I navigate this one, I mean, with maybe say parent and youth, like we'll have a session or we'll talk and, we'll get to know each other. I'll talk to the youth by themselves, and then often I'll talk to the parent by themselves at the end. And what I would do as far as I normalize that if there's any kind of grief, fear, because, it's super normal to have these things show up and happen. And I do want to normalize that. I do want us to normalize that, as counselors for parents. It's just when that becomes like, well, then I can't accept my child, or I'm going to misgender my child, or I'm going to make mistakes and not be held accountable. When it goes into that territory, then it gets a little tricky, right? But at least in the grief or in the fear, you can acknowledge that fear and being like, hey, I'm going to set you up with some parents or families or community resources, or hey, I really recommend you seeing a therapist yourself so you can process some of that, because it's okay to be scared, because we know the way that the world often treats, gender expansive and gender nonconforming folks, especially, folks of color and with disabilities, etc. Let's see, what is that big list?
It looks like that's all the questions like that are listed now. So if anybody has any other questions, please feel free to type them in. I also, since I'm talking, want to just put a reminder out there that if you have not done so, please type your name in the chat box so that we have that as a record of attendance. You should receive the evaluation shortly after this webinar completes so that you can fill out that evaluation for continuing education credits. And then within the next few days, we will send out all of the resources that Lucas has talked about, the PowerPoint, and a recording of this presentation. But take a few minutes to type any last questions into the chat box.
Thank you. Thank you. Yes, any other questions, or if there are things that you want to email me separately about, that's also, I welcome that. I think at this point I'm caught up on my emails, so I should be pretty quick. But I really appreciate you all showing up and being here and caring about youth. And just remember, you know, you showing up for youth, they see that and they know that. So thank you for your commitment to being here and to your youth. Thank you. I'll make sure I keep an eye out for my emails.
Lucas, what advice would you give a novice counselor working with gender expansive population?
Great question. Everyone's showing up with these great questions today. I appreciate that. What advice? I would say write down my email and email me, and I'll make sure I send you directly some resources and things that have been helpful. I'll send you a couple books as well, things that have been helpful, both like for, you know, as a counselor, but also in understanding identity a little bit better. And just connecting you with other therapists who have knowledge, attending as many webinars or things as you can. And there's a few counseling books related to trans and gender expansive identities that I can also send you, or things that I can send you as well. So just go ahead and shoot me an email.
Okay, so if that is all the questions that we have for today, thank you all for attending, and we look forward to your feedback.
Yes, thank you all so much, really. I look forward to the feedback.